my name is Megan Carter, and this will be a role-playing exercise to fulfill the requirements for N5382 healthcare policy at the University of Texas at Arlington School of Nursing. I'll be playing the role of myself, and my colleague here will be playing the role of Congressman Smith, who is a federal House representative in my district. I'll be attempting to convince him to pass the H.R. 2713 bill during this congressional session. Hello, Representative Smith. My name is Megan Carter, and I'm a nurse leader in your home state of Texas. I wanted to present you with my brief on H.R. 2713. As your constituent, it's very important to me that you see the impact of this bill on my profession of nursing and the patients we care for in the Lone Star State.
Well, hello, Megan. It's very nice to meet you. I have a lot going on today, but if you can make it quick, I'd be glad to hear your brief.
Sure, I understand.
I'm familiar with Title VIII funding for nursing education, but please tell me why this bill matters to you.
Okay. So thank you very much, sir. I see that you're the ranking member of the Subcommittee on Health, so I know you have considerable influence over policies affecting healthcare in our nation. I typed up this one-page brief for you to review at your convenience. In short, it is the bipartisan work of Lois Capps from California. She has actually been a nurse for over 30 years, and she's one of 6 nurses in Congress at this time. She actually has proposed this bill to amend Title VIII of the Public Health Service Act of 1964. Her amendment specifically seeks to add clinical nurse specialists to the language of the bill for the purpose of promoting funding for their education.
Well, I'm not sure I understand what a nurse clinical specialist is and why it should matter to me.
So a clinical nurse specialist is a type of advanced practice nurse with at least a master's degree who can provide primary and acute care services to patients independent of a physician, depending on the state's scope of nursing practice. Their role, along with nurse practitioners, helps to fill a gap in access to health care for millions of Americans. They can run nurse-managed clinics in rural areas and promote community health where there are few physicians. As you are aware, the recent Affordable Care Act highlights the importance of access to care. The Institute of Medicine and the American Nurses Association have also called Congress to action recently to ensure advanced practice nurses are not limited in their scope for the same purpose of improving access to much-needed health care. It also drives down the cost of healthcare as their services are typically not charged at the same rate.
So what does Title VIII have to do with that exactly?
So Title VIII funding is allocated annually to many nurse education programs, grants, scholarships, and loan forgiveness to increase the number of nurses for our country. This particular bill intends to add clinical nurse specialists to the group of nurses who benefit from this vital funding. At this time, a large majority of nurses who benefit from this funding are from undergraduate, NP, or nurse educator programs. A recent survey by the American Academy of Colleges of Nursing, who monitors Title VIII fund usage, showed that 38% of their respondents in graduate level programs plan to serve as advanced practice nurses in underserved or rural areas in their home state. Ultimately, this funding and the bill's proposed additions increase the health status of our community and decrease the cost of the care provided.
Well, you've certainly given me a lot to think about. I'll have my staff arrange a closer look at this.
Okay, thank you for your time, sir.